We're the flagship for the state of Virginia for dealing with complex health issues. Our team members are outstanding for taking care of that heart attack and helping to prevent the next one. But what we also want to have an emphasis on is primary prevention. Can we prevent heart attacks? Can we prevent strokes? Can we prevent the development of heart failure? This enables our ability to address problems before they require hospitalization.
When you start to look at some of the heat maps for cardiovascular disease, cardiovascular mortality, Petersburg and parts of Richmond have some of the worst health statistics in the state. We know that there are health disparities based on gender, based on race, based on socioeconomic status. So it's something that we have to address on multiple levels.
There are many risk factors: high blood pressure, diabetes, smoking, inactivity. What's one of the most important risk factor? And that's high blood pressure.
So uncontrolled high blood pressure or hypertension, if we could change that, we could definitely change the trajectory of those heat maps. Tell them, you need to know your numbers. It's at normal, it's less than 120/80. And I tell them that one of the two things they can do to help to control their blood pressure is to reduce their sodium intake and to maintain a healthy weight. And I think most people have that desire somewhere within them to know more, to understand more. It's just how do you tap into it? What do you give them so that they can take it that next step?
We've made strategic investments. One is the recruitment of Dr. Anurag Mehta, Director of Cardiovascular Disease Prevention, bringing great knowledge on how to identify who's most at risk for having a future event, but also implementing the most modern therapies. It's an individualized prescription to that patient's constellation of risk factors. Some are medications, or when to invoke a particular type of diet, a particular activity prescription that then is implemented to prevent the future cardiac event. Another has been to raise awareness of high blood pressure in the community.
The blood's going to come in here, and then it's going to go into your right ventricle.
Dr. Sangeeta Shah has a great program that she set up called Teach BP to work with 4th and 5th and now 6th graders, train them about high blood pressure, train them about health habits that help to prevent high blood pressure.
What's unique about this program and why we're so grateful to the Pauley Heart Center is that our kids become the teachers, taking that home in particular to their families, their grandparents, their dads, their moms, and playing an active role in improving their health. Everybody wants their family to be healthier, live longer, be with us for more of our lives selfishly. I have reconnected with my biological father after over 50 years. He has had blood pressure problems and heart problems for most of his adult life. I personally, all these years later, have seen the power of the influence of a child, no matter how old. This one is 61, to commit to changing our behaviors. And I really believe that one child at a time, providing that influence, will literally change our city.
We're most grateful to those that contribute philanthropically, and without that, we would not be able to realize the potential in addressing cardiovascular disease. If we can prevent the causes of heart failure, then patients can have an increased quality of life.
I've seen the heart attacks and the heart failure and folks who needed transplant and folks who had major vascular issues. And when I look at a lifetime career, it's like, what am I really doing if all I'm doing is, here, stamping out the fires when they come up and not making sure the fires don't get started?